Maybe John does care about his bald spot after all. In 2005, at the age of 28, when we look at his hairline, we can see that there's a central part. And while central parts are fairly rare in men, they of course do occur. In 2006, at the age of 29, what we see here is that John has strong anterior temporal points, and that helps frame his face. And John's natural hairline is quite straight. In 2007, at the age of 30, what we see here is that the directional split at the central hairline occurs only for the first 1 to 2 inches of the hairline. Then further back, it changes to a more anterior facing type of directionality. And in 2008, at the age of 31, I want to point out here that his crown hair looks quite strong. In 2015, at the age of 38, when we compare back to John at the age of 28, so 10 years prior, we can see some very slight frontotemporal thinning. His hairline is now slightly less straight. When you look at John Cena's crown in 2015, you can already see some thinning hair. And in 2017, at the age of 40, in my opinion, John's crown loss appears stable. In 2023, at the age of 46, this is around the time that a lot of people started to talk about John Cena's hair, and they were concerned about his crown loss, and they were wondering, why he hasn't had it fixed, right? So that was a lot of what was being said online at that time. But then in 2024, with this increased attention on his crown thinning, John Cena had the following to say: "Man, I know I got a bald spot on the back of my head. I flossed it at WrestleMania. Me, you, and like 7 out of 10 dudes have them. So I don't care. I'm not perfect. That's not me." But then 2025 hit. Maybe John does care about his bald spot after all, but I do think that it's unlikely that he had a hair transplant. Just the timing of it all and the lack of scarring that I'm seeing just makes me feel that it's most likely not a hair transplant. But remember that there are many ways to conceal thinning hair. Some people wear wigs on their head. Sometimes they're called hair pieces. Others use fibers, which is probably the most common way to cover up some areas of thinning. Yet other people get less invasive procedures like scalp micropigmentation. And then of course there are people who just get very creative with their hairstyles, and they're able to cover up some of those areas that have thinned.